So when I was 7 years old, I was very cool. And I didn't really have to think about things like what I was wearing, what my house looked like, where my food was going to come from. I pretty much had it made. And one day, I was playing outside with my very cool friends in the neighborhood, and my dad called me to come inside because he said, "Your mom's on the phone." This is totally normal because my parents had divorced the year before, and so whenever I wasn't with my mom, I talked to her on the phone. Nothing new. And this time, when I answered the phone, there was something kind of different about her voice. It was really calm and really firm. It was almost like she knew that she had to deliver this information swiftly and matter-of-factly, or everything was just going to fall apart. So she said, "I have something to tell you. I have HIV." Well, I had heard of this as a 7-year-old, mostly in the context of things that are bad, like promiscuity and drug use. And I didn't really know how to identify this feeling at the time, but I felt shame. I felt like maybe I wasn't supposed to talk about this. And so I'm sure she talked me through it. I don't really remember the other details of the conversation, but I went back outside, back to my friends after this phone call, and I envied them because they could still just play and kind of not care, and they had no idea how much everything had completely changed. But I couldn't tell them. I couldn't share it with them. I just kind of kept it inside. And I recently learned what it was like for my mom to receive this information. She was about the age that I am now when she was diagnosed. And she was a teacher at the time. And she felt like if she disclosed her illness, it would jeopardize her career. That maybe parents would be afraid to bring their children to her class because people didn't understand HIV back then and still don't in some cases. And also at this time, receiving this diagnosis was basically a death sentence. No one really knew what it meant or how long you would live, but she was a mother of a 7-year-old and a 3-year-old. And all of a sudden, she realized, I might not get to see my kids grow up. I guess I have to change my hopes and dreams and manage my expectations. Okay, what am I gonna do? I guess, gods, if you're there, just to give me 5 years, she said. Imagine the weight of a terminal illness alone. But then on top of that, the shame, the isolation that comes along with that, of having to carry this all by yourself, the fear of judgment. When I was 11 years old, I was less cool. And I started middle school. And I sort of think middle school is kind of like eating from the tree of knowledge, right? You just all of a sudden realize everything about yourself is totally embarrassing. So my great struggle of 7th grade was the lunch line, because I was on the reduced lunch program, which is a food assistance program. And in order to receive my reduced lunch rate, which was 35 cents for a full meal, I had to get to school early and go to the cafeteria before school started and give them my money and my name, and then they would check me off when I went through the lunch line just on a list. But as no 7th grader has ever gotten to school early, I didn't either. And so my other option was during lunch, in the presence of all of my friends, I had to say when I got to the cashier, "I'm Amelia Pape and I'm on the reduced lunch program, so here's my 35 cents and I'm supposed to get a full meal." Well, I didn't do that because I had enough going on with like the white socks over tights and the violin and like Dallas Cowboys oversized jacket situation. I didn't need another thing to make me stand out as weird or different. I didn't want to be a poor kid. I was ashamed. So I kept it to myself. I didn't say anything. I just went through the lunch line and I bought what 35 cents would get me at cafeteria retail, which was like a chocolate chip cookie. Now, I wasn't really poor. I could always go home and eat to make up for my terrible nutrition at lunch. But not everyone has that opportunity. How often are we afraid to express our needs, and that keeps us from the things that we need to be healthy? In America, 1 in 7 people are food insecure, and that means the state of being without reliable access to a sufficient quantity of affordable, nutritious food. It's kind of academic. Among these 1 in 7 Americans, 69% have had to choose between food and utilities. 57% have had to choose between food and housing. 66% have had to choose between food and medical care. The stat that I couldn't find is how many people are choosing between food or the things that they need to make them healthy and pride. How often is shame the barrier to access? I imagine it's a pretty high number. I know it was true for me when I was 11. I know it was true for my mom when she was diagnosed with a terminal illness and needed support. In Oregon, the number of food insecure is 1 in 6. Oregon ranks 3rd in the nation for food insecurity growth. And 51% of children in Oregon qualify for the reduced lunch program. I wonder how many of them use it. Imagine struggling with food insecurity. Imagine having to make a decision like, am I gonna turn on the heat tonight or feed my family? Am I gonna get the drugs that I need to be well or have a meal? These aren't choices. And if you're in the crowd right now thinking, I don't have to imagine this, I've lived this. I'm living it right now. Don't make me raise my hand. I'm not going to. But if you don't hear anything else that I say tonight, what I want you to hear is that I see you, and you're worthy of being seen. 5 years ago, I graduated from Portland State with an MBA, and then I started a business, fairly traditional. It's a social enterprise called My Street Grocery, and it's a mobile grocery store with a mission to improve fresh food access for all. I didn't really know what I was doing, and I think that most entrepreneurs will tell you the same thing if they're being honest about when they start a business. But with the support of friends and family and professors and colleagues and mentors and a community, I did start a business. I raised money to buy this old friend's bread truck, loaded it with fresh foods, and went out into the community to provide access to underserved populations. And what I quickly learned was that bringing food into a community that has limited access is not the end. That's the beginning. That's one small piece of this work. But there are all these other intangible things: transportation, financial resources, education, cultural appropriateness, housing, cooking skills, all of these barriers to access that are harder to see. And all of a sudden, this problem felt so overwhelming. I had gotten in over my head. There's no way that me and my bread truck could solve this problem. Everyone had counted on me and believed in me and supported me, and now I was a failure because I didn't solve food insecurity. Well, I did something that I'm really proud of after a few years of this, and it's something that I'm still learning how to do. I expressed my needs. I asked for help. And sometimes when you do that, the universe is like, okay, we're gonna give you something here. And you know the experience of meeting a person or meeting someone where you kind of have this alignment where you're like, we have work to do together. That happened for me, but the person was actually a company. It's a national retailer, Fortune 500 company called Whole Foods Market, that saw me and said, yeah, we have work to do together. Our values align. Let's do something. So My Street Grocery was acquired by Whole Foods Market, and I got hired to be the company's first food access coordinator. And My Street Grocery is now the company's first mobile grocery program right here in Portland, Oregon. And it's surrounded by resources and expertise, and we're serving more communities than we ever have before, and it's great. But we still didn't solve food insecurity. So there's something else. What are the other intangibles? And then I got a call from a nurse at the Legacy Good Samaritan Clinic in Northwest Portland, and she said, I heard about My Street Grocery, and I work at a clinic where we have a disproportionately high number of low-income and homeless patients, and they're struggling with chronic diseases that are very diet-related. Do you think that My Street Grocery can help? And I said, yeah. I didn't know, really. I didn't know how. But I knew that we had work to do together. So what actually happened was we wrote a small grant, which we were awarded to run a pilot for a food prescription program, where instead of getting a prescription for drugs from your doctor, if you're screening positive for food insecurity, you can get a prescription for food. And not only that, but you could walk right out the door from your appointment into the clinic parking lot where My Street Grocery was parked every Tuesday from 10 to 2 and redeem your food prescription for fresh food. And we watched the redemption rates in this pilot, and we saw that the national average redemption rate for drug prescriptions is about 60%. At the food prescription program, we were well above 90%, in some cases 100. So something was working. There was some value in this. So much so that we're now in our 4th year. We're working with 10 clinics throughout the metro area, from St. Helens to Gresham. And we're running the first and the longest and the most robust food prescription program in the Portland metro area. And in the 2014 Farm Bill, the federal government allocated millions of dollars to fund nutrition incentive programs like food prescriptions all over the country. That's nothing to do with me, but it's a great statistic because it works. And we started to see positive health outcomes. In preliminary studies, all of our program participants saw their diabetes management improve, their BMI improved, their weekly intake of fruits and veggies went up. But the statistic that I'm obsessed with is the one about depression, because it seems surprising, or at least not obvious. People were reducing their depression by coming to some mobile market in a parking lot of a clinic. What does that have to do with food security? And then I started looking around, and I realized that this wasn't even about hunger alleviation anymore. It was more than me and more than My Street Grocery and more than the food that we brought. It was bonds being formed. It was community being created. We, like I said, are in our 4th year now, and we have patients who still come to the original pilot location, which is still every Tuesday from 10 to 2. This is some of our regular customers. That's Diana and Shirley. And this year, Diana made Shirley this beautiful quilt for her birthday. They met each other in a parking lot. Food is the hook, but community is the glue. I always wanted My Street Grocery to be this thing that helped to solve a social problem. But what I didn't know was what social problem I was actually going to adopt as my life's work. Not just food security, but security. We all know the experience of not knowing how to help someone. I don't know what to say, I don't know what to do, so I made you a casserole. Dinner is an excuse to get to know someone on a first date. We put fruits and nuts on altars as offerings to the gods. Food is a vehicle. Food is community. And when we have a sense of community, we start to reduce our feeling of isolation and shame. When my mom was first diagnosed all those years ago, she begged for 5 years. And she didn't get that. She's on 25 years and counting, with no signs of slowing down. And she'll tell you that medicine kept her alive, but the thing that gave her her life was being surrounded by a community that supported her and that said, I see you, and you're worthy of being seen. There are hundreds of social problems out there, thousands, millions, and we can start businesses to solve them. That's the beauty of social enterprise. We can use the power of business to make a positive social impact. I'm not saying it's easy. It's incredibly hard, but it's possible. And if your calling is to be a social entrepreneur, awesome. Please do it, even if you think you don't know what you're doing, because it matters and we need you. But if it's not your calling and you still want to make a positive social impact, you can. There are things that we can all do to chip away at a serious social problem that affects each and every one of us. When you see someone struggling, a friend or a family member or a kid in the lunch line or a patient at a clinic, you can say to them, I see you, and you are worthy of being seen. And if you don't want to say that with words, you can say it with a casserole. Because that's the power of food. And we're not just a bunch of statistics. We're faces. We're people. And when we start to realize that community is the thing that not just keeps us alive, but gives us life, we're starting to move the needle. When we think of food only as a source of calories, we're missing a huge opportunity. When we think of health only as the absence of sickness, we're missing a huge opportunity. And it's not our job to solve all the problems in the world, nor is it possible. But I think it is our job as global citizens to not just coexist, but to find a way to live in community so that we don't just survive, we thrive. And in order to do that, we have to see each other and to be willing to be seen. And you can do that right now. You don't have to start a business. So not that you need it from me, but please consider this an invitation to give it a try. Thank you.